So good morning, everyone. So today we are having a webinar session on the case study method in nursing research. So first of all, I would like to wish a very happy and prosperous new year to all our viewers as we are doing the webinar on this New Year day. So today's topic, that is the case study method, which is, even though it is a very important method in the medical field as well as in different professions, but which it is a less discussed method. So that's why it is one of the significant method also, and we have selected this method for as today's webinar topic. And for discussing the webinar in detail, for taking the session, we have among us a distinguished and eminent resource person. So the resource person for today's session is Dr. Smriti Arora ma'am. Ma'am is currently working as professor at College of Nursing, MT University, Haryana. And ma'am is the PhD nursing coordinator at MT College of Nursing. Ma'am is having a work experience of more than 19 years. And ma'am has completed her BSc Nursing as well as MSc Nursing in Pediatric Nursing, College of Nursing, AIIMS, New Delhi. And ma'am has completed her PhD in Nursing from Indian Nursing Council. And ma'am has published 2 books and with having more than 190 citations. And Dr. Smriti ma'am has been a resource person for more than 60 national and international conferences and has been a national trainer for NRP, that is the Neonatal Resuscitation Program, and HIV/AIDS and quality improvement. Ma'am is a national mentor under lecture program for nationwide quality care network. And Dr. Smriti ma'am has bricks for her contribution in basic newborn care and resuscitation program. Ma'am has also undergone a training course in traditional Chinese medicine at Beijing, China. Ma'am is a recognized PhD nursing guide by INC and also has guided more than 40 MSc nursing students and currently guiding PhD nursing scholars at MT. So with this brief introduction, I would like to heartily welcome Dr. Ma'am to kindly take over the session. Over to you, ma'am.
Thank you, ma'am Rosemary, for that beautiful introduction. So at the outset, I would like to pay my regards and gratitude to the organizer for giving me the opportunity to speak in front of you all. And a very happy new year to all of you. So let's start the session today. And today we are going to discuss about the case study method of research. Okay, so the slides are visible?
Yes, ma'am, it's visible.
Okay, so we are going to talk about case study method in nursing research. So the objectives of today's sessions are, we are going to define what is it, what are the advantages of using a case study method over other methods of research, what are the features of a good case study, where it can be used, what are the steps of the case study, and how a case study should be reported. So case study is a research methodology which is typically seen in social and life sciences. It is most widely used method in academia for researchers who are interested in qualitative research. So it is most often used by the researchers who are doing qualitative type of studies. You can say that it is a chronicle of patient's progress, how the patient is progressing. As we say the word case study, that means we are going to talk about either a single patient. It can have different varieties also, like you can have a single patient also, or you can have 2 or 3 patients also. Then we call it as a multi-case study, or we call it as a case series also. and then you are going to describe. So it is a narrative form of a thing. So you are describing how a patient is progressing from day one to discharge, and then follow up, and what is the key message in that entire case. You can also say that it is a form of biomedical storytelling. So we are describing the researcher, he is describing in his own words that how the patient has progressed, what were the investigations, what were the findings, and what were the results. So holistic nature of nursing care can be addressed through a case study approach. So whenever we are trying to describe a case, so whatever the nursing care we have provided, that all can be explained in words through this method. So that's why we say that the holistic nature of nursing care can be addressed through this approach. So what type of research method is this? So usually it comes under qualitative approach, but some people say that it comes under quantitative, also under descriptive studies, and it can also come under mixed method research as a part of qualitative research. Now in this case study research, the case is studied within a bounded system. That means the time and the place is fixed. So within the certain time frame and at a certain place, we are conducting this study, like in a particular hospital, in a particular ward, that this is the patient admitted for this time, and we are going to study his case. So it is time bounded and also place bounded. Coming to the definitions, it is an intensive systematic investigation of a single individual. Okay, so you are studying a single person. You can study a group of people also, because in case study we say that it is a type of a qualitative research. So we want to study a patient also. We can study a phenomena also. We can describe a phenomena. So then we say a group. We can talk about a community or some other unit in which the researcher examines the in-depth data relating to several variables. And the aim is to generalize the over several units. So whenever we do studies, what is the aim of the study? That we want to generalize the findings to the wider population. So that is the aim. And now who we are studying? We are studying either it is a single person, or it is a group, or it is a community, or the concept which we want to study. So whenever we are talking about the case study, we have to keep in mind that the background of this lies in the qualitative research. So case study research offers the researcher an approach by which a phenomena can be investigated from multiple perspectives, right? So we can study a single person also, or we can describe the phenomena also. That what is the phenomena of the nurses' perceptions when they are administering care to the certain group of people. So that also we can describe. So within a bounded context of time and place, we are trying to examine the phenomena or a case, allowing the researcher to provide a thick description of the phenomena. So as we said that much of the statistics or the numbers will not be involved, but it is going to be a rich description of the whole phenomena. It is going to be a narrative view of the researcher. And since the researcher is describing in his own words, sometimes we say that the researcher can have bias also. So that is one of the limitations. So what is the possible focus of case study? So it can be a project or organization. It can be an event. It can be a person, or it can be a group. So what all we can study? We can study a case, a group, a phenomena, an event, or a whole project or organization, or even the program also, that whether this program or the intervention is working or not on a certain group of patients, that also we can explore. So it is basically exploratory in nature. Now, what are the advantages of case study approach? Case studies are invaluable
Excuse
record.
me?
Yeah.
Ma'am, I think the slide is not moving, ma'am.
Slide is not
It's
moving.
still on the first slide, ma'am.
Just a minute.
Yes.
I will reshare it because I have gone to, I think, third or fourth slide.
Yes.
I have come to advantages.
Okay, ma'am.
You have seen this objective slide?
No, ma'am. Only the first slide we have seen.
Okay.
The first
So
one.
I'll just go through this quickly.
Yes, ma'am.
So
Yeah.
the objectives are that we are going to have the definitions. We are going to understand what are the advantages, what are the features, what are the users, what are the steps of case study, and how to report a case study. Then the next slide was regarding the introduction. As I said, that it is a research methodology which is usually used by the social and the life sciences, and it is mostly used by the researchers who are interested in qualitative research. So it is a chronicle of patients' progress. It is a storytelling approach. We can also say that it is a biomedical storytelling. So the holistic nature of nursing care can be addressed through this method. So it usually comes under qualitative approach or a mixed method approach, but some people say that it comes under quantitative or descriptive area also. And here the case is studied within a bounded system of time and place. So these were the definitions which I had discussed, that it is an intensive and systematic investigation of either a single individual or a group or a community or some other unit in which the researcher examines in-depth data relating to several variables, and the aim is to generalize over several units. So aim of the research is to generalize the findings. Case study research offers researcher an approach by which a phenomena can be investigated from multiple perspectives. So when you are investigating a phenomena through multiple angles, you are trying to find the reality, you are trying to find the answers within a bounded context, and the researcher is trying to provide the thick description of the phenomena, that how the things have occurred and what are the results and how we can further use it in our practice. So the possible focus of case study is, it can be a project, it can be an event, it can be a person, or it can be a group. Now coming to the slide, that is advantages of case study approach. So every research methodology what we study, whether it is a descriptive or interventional, each one has its own merit and demerit. So what are the advantages of a case study approach? They are invaluable record of the clinical practices of a profession. Whenever, a patient is admitted in the hospital, we are maintaining the records. A patient is being treated by different members of the health team, whether it is a nurse or a doctor or a physiotherapist or a radiologist. So all his findings are documented in the papers. So that data is very rich, and through that we can come to a lot of conclusions, and that can help us in framing new questions. So their record of clinical interactions, they help us to frame the questions for more rigorously designed clinical studies. So they can give us the platform from which we can take out more questions. We can frame new hypotheses, we can have new research questions, and then we can put them in the experimental studies, and then we can test the hypothesis. So it provides a very good platform for us from where you can take the new research questions. Case studies also provide valuable teaching material, demonstrating both classical and unusual presentations which may confront the practitioner. So as in our nursing, you see, always you are writing your nursing care plan, your case studies, and your case presentations. But when we do our care plans or the case studies, the same thing we are doing, in depth we are doing. But we generally don't focus on very unique case, right? For example, when we are dealing with our students, we try to teach them the common disease conditions which are happening in our wards, like common respiratory conditions, GI conditions. But when we talk about the research, we try to do a case study on such topics which are very interesting, which are unique, which are something new. And when we collect the data, when we organize the data, and when we report those findings, so it becomes very interesting for the audience also to understand that, okay, this is something new which has happened, and how we can use this knowledge to further increase our practice or to further better our practice. So another advantage of case study is that once we have reported our case study nicely. It can be published if we have followed all the guidelines properly. The case study, it provides a very detailed information. See, like in the experimental studies also, you have certain steps which you need to follow. There are certain headings in which you will describe the things like an introduction, background, methodology, results, conclusion. Similarly, there are certain guidelines under which you have to give the complete description. So when that rich description is there, then it becomes very beautiful and it becomes very interesting for audience to read it. It allows detailed investigation into the situations which would be unethical or impractical to perform using another study design. So there are some case scenarios in which we cannot use some experimental approaches. So in those cases, we can use a case study approach where we can study in depth about a particular case or a diagnostic technique or any therapeutic intervention or any other program, and then we can report our findings. Now, what is the difference between an experimental design and a case study approach? So experimental designs, if you see, it seeks to test a specific hypothesis through deliberately manipulating the environment. So in experimental studies, the main features are what? The randomization, manipulation, and control. And giving the intervention is the most important thing in the experimental designs. So you are testing a hypothesis that you have given the intervention, and then you are checking whether it's working or whether it's not working, and you have different groups also which you are comparing. Whereas in case study approach, we are not deliberately manipulating the environment. It has to happen. If somebody has come with some disorder, you need to give the treatment, and then you see that what is the effect of that treatment. So it captures information on more explanatory on how, what, and why questions. So instead of focusing on statistics and number and the p-value, here we are focusing on more of the descriptive type of answers. That how was the intervention delivered, what gaps existed in its delivery, and why one implementation strategy might be chosen over the another. So you are getting a more narrative type of answers. And this type of methodology, this can help in developing or refining the theories. So your body of knowledge is increasing. You have your theories also. So you can either refute that theory or you can develop a new theories based on this methodology. So in this type of methodology, you are trying to answer how, what, and why type of questions. So what are the features of a case study approach? In this, there is identification of a case. You try to find out a case which is very interesting, which is very unique, and which you want to tell to other people also, which is very interesting. So in a case study approach, there is in-depth understanding of the case or diagnostic technique or any intervention. So the objective is to explore the phenomena, to describe the phenomena, or to explain the phenomena. That is the main objective. In maximum number of words, we are trying to explain the things, the whole phenomena, that how the patient came, what were the patient findings, what all investigations were done, what were the findings of those investigations, and if any specific new intervention was given, then how it was given and what was the outcome. So no numbers are involved. Data analysis depends objectives of the case study, that whether you want to describe the phenomena, whether you want to report something new. And analysis is usually descriptive, or you can also do thematic analysis. You can make different themes and then you can describe your findings. So case study approach allows in-depth, multifaceted explorations of complex issues in their real life settings. So it is, if you have studied the chapter on qualitative study, so you can understand it is all the things what we are trying to describe here. It is just like your qualitative study, that you are trying to explain the complex issues in the real life settings, like a grounded theory. Then another feature of case study is that it is easy to conduct, because the researcher is there, and the patient is there. it is time bound, it is place bound, and only single case is there. So you don't have to collect sample from 100 or 200 people. Limited number of sample is there, and then you are describing. And another feature is that you are trying to identify rare manifestations of any disease or drug. So through these case studies and case reports, you come to know if you have been giving a new drugs to some patients and some adverse event has taken place. So then these case studies are very valuable. For example, the use of thalidomide leaded to phocomelia, the absence of limbs in the children. So if somebody had reported, then only we came to know that these type of things are happening. So case studies are also very important in research methodology, in improving your knowledge, in increasing your knowledge. Now, if you see the hierarchy of evidence, at the baseline is your editorials and expert opinions. Then comes your case series and case reports. So this is the blue one which we are studying. So it is at a very low in the hierarchy of the evidence, but it is also very, very important. Something which is below doesn't mean that it is not important. So always we are, focusing our students to do more of the experimental studies, RCTs, systematic reviews. But it's also important that we teach them these type of studies also, because something new, something unique, some new methodology will be learned and they will gain a new understanding of this subject. So above the case series or case reports is your case control studies. Then we have cohort studies. Then we have RCTs or randomized control trials. And on the top is the systematic reviews. So case reports, they do not rank highly in the hierarchy of the evidence. So which is at the topmost? That is the systematic reviews or the RCTs. And at the baseline is the case studies, but yet they are very important. Case studies are not frequently cited. If you go and try to search in PubMed or in the different search engines, you will find a lot of RCTs, lot of systematic reviews, but they are not frequently cited. What? The case studies, as they describe the clinical circumstances of single patients. Okay, when we say case study, that means we are trying to describe, usually it means that we are trying to describe the condition of a single patient. Although we can take 2 or 3 patients also, then the word will be called as case series or a multi-case study. So this is one of the limitations, that as you are taking a less number of patient or a single patient, so you cannot generalize the findings, and that's why they are seldomly published by high impact medical journals. But in order to understand the phenomena, it's a very good approach. However, case reports, they are proposed to have significant educational value. Yes, so they have very significant educational value because you are learning something in depth, and they advance the medical knowledge, and it constitutes evidence for evidence-based medicine. So there is an evidence that you have given this drug and this is the reaction. So it constitutes the evidence for evidence-based medicine or evidence-based nursing. Now, where all we can use this case study approach? We can use this case study approach, as I said earlier, in all those cases where we cannot follow experimental approach, we will go for case study approach. When you want to describe in detail the patient's episode of care, okay, different modalities of care are there. If you specifically talk about nursing, different methods of care are there, different nursing theories are there. You have given the care through a particular nursing theory approach, and then you want to tell to the people, okay, this theoretical approach is working. So at that time, you can use a case study approach. For example, you must be remembering about the various nursing theories, right? Orams is there, Levine's is there. So one of them you can apply, and then you can see that whether it is working or not working. And then in the end, you can see that we are testing the theory. Okay, so it is either refuted or it is accepted. It can also be used to explore various professional attitudes. So it is a qualitative type of a study, it is a descriptive type of a study. So you can explore that what is the attitude of nurses towards this or people towards this. So those type of areas can be explored. When you want to understand the experiences of a new policy initiative or the service development, the Sarkar has suppose started some new policies and you want to see that what is the experience of people, of the public, they are liking it, what are the hardships they are facing. So for that in-depth data, you can go for a case study approach. Then if you have identified an unexpected association between the disease and symptoms, at that time you can use this case study approach to tell to people that whether some unexpected association is there or not. When you want to report any unexpected event in the course of observing or treating a patient, for example, you are treating the patients and some unexpected event has occurred. Always you were giving the care to the patient and they were becoming okay, but now something unusual has happened. So at that time, you can pick up that case and then you can describe and then you can report the findings. When you want to report the findings that shed new light on the possible pathogenesis of the disease, some new disease condition is there, some pathophysiology if something is changing, and this we can see every day we are talking about this COVID-19, new variants are coming, the pathologies are changing. So by a single case study, we will study and then we are trying to find out that what is the ultimate truth. Now this is one of the example, the relationship between thalidomide and the bird defects, or if there are any some unique or rare features of any disease or any unique therapeutic approaches, what was the effect of that, whether it worked, not worked, were there any harmful effects. So in all those cases, you can use a case study approach, and finally you can do the theory testing and you can confirm or refute a theory. Now, which clinical questions does case study, case report or case series have the best answer? So we are going to adopt this method of research in case there are emerging conditions, adverse reactions to some treatments, atypical or abnormal behavior, new programs or methods of treatment. All of these can be answered with case studies, case reports or case series. So as I told earlier, what is the difference between a case study and a case series? So case series constitutes 2 or 3 cases together. They are generally descriptive studies which are based on qualitative data. That means you are collecting the data through observations, interviews, questionnaires, diaries, personal notes or clinical notes. So it all comes, it is a basically you can say a small type of a qualitative study which is following all the steps of a qualitative study by how you are collecting the data, how you are reporting the data in that form. So a case report is a detailed report of the diagnosis, treatment, response to the treatment and follow-up after treatment of an individual patient. So that is case report or a case study. What is that? A single patient you are studying in detail. That what were his signs and symptoms, with what complaints he came, what diagnostic techniques were done, what treatment was given, what was the response to that treatment, and what was the follow-up after the treatment of an individual. So in-depth study of a single patient. And what is case series? This is the doctor and these are the patients. A case series is a group of case reports involving patients who were given similar patients. So these are the different patients who were given the similar patients and what was the outcome that we are going to compare. So a case comparison also can be done between the 2 or 3 patients. Now, what is the difference between a single case study or a multiple case study? So if a researcher wants to study a specific phenomena arising from a particular entity, then a single case study is warranted. Okay. A single phenomena you want to describe in detail. So it allows for in-depth understanding of a single phenomena. It would involve collecting several types of data. So if you want to explore some phenomena, describe some phenomena, for example, the management of pain in children, you want to see what is the phenomena of that among the nurses. So you will try to collect the data from different angles, right? You can do observation also, that whether they are assessing the pain, how they are managing the pain. That is the observation technique. Also, another technique you can use is that you can give them questionnaire, and then you can ask them to fill the form, the self-reported their practices, and then you can see that whether whatever the phenomena which they are writing in the questionnaire, that they are managing the pain appropriately, and what they are actually doing, whether both of them are correlating properly or not. So you are trying to come to the truth by performing different types of observational techniques, right? You are collecting data through different methods to come to the reality, to come to the answer, or to describe that phenomena which is happening in that place. So when we say single case study, you can do in-depth study of a phenomena also, or of a single person also, a single case also. Now, when we talk about the multiple case study, what it means, it allows for more depth understanding of cases as a unit. So 2 or 3 cases as a unit you are trying to understand through comparison of similarities and differences of the individual cases. So all of them are having same disorder and they are giving treatment. So what is the similarity and what are the differences between them, which are embedded within the quintain. Quintain is a group of cases. So evidence arising from multiple case studies is often stronger and more reliable than from a single case research. Okay. See, since beginning we are saying that case study means we are going to describe about the single patient only. That's why we are not able to generalize it. So that is one of the limitations. So if we compare this single case study with the multiple case study, so this one is better because the evidence which is coming from multiple cases, it is more stronger and more reliable as it is from a single case approach. So multiple case studies, they allow for more comprehensive exploration of research questions and theory development. Now coming to the next heading, that is how are the case studies conducted. So the conduction of the case studies is similar. Whatever the steps we follow in different in the research, the same steps have to be followed. First you have to, normally in research, what is the first thing you do? You identify a problem, isn't it? Then you do review of literature. Then you prepare your tools, then you collect the data, then you do the calculations and report the findings. And the same, almost similar steps are done in the case study also. So before starting the case study, you need to familiarize yourself with the case study type. What is the style and what is the design? So as a student, as a researcher, if suppose I say that I want to do a case study tomorrow, so before that, first I would like to read in detail about the methodology of case studies, right? That how it is conducted, what are the advantages, what are the disadvantages, and finally how I am going to report this thing and how I am going to do all the recordings. So the first step is you need to select the case. Like in the normal studies, we make an aim statement, we make the objectives. Similarly, so we have to keep in mind that what do we want to achieve out of this case study. Whether you are going to give some recommendations for the further practice, whether you want to describe some phenomena, or whether you want to just report some unique findings. So what is the objective of the case study? What are you going to try to achieve through this process? That must be clear in your mind. So the first step is defining a single case or identifying a group of similar cases that can be incorporated into the multi-case study. So a search to determine what is known about the case is typically conducted. So when you have identified the case and then you go and study in detail that what is already known and what is not known, what is the gap and how I am going to describe it. So this will include a detailed review of literature, also studying the grey literature, the media and reports. Why you are going to do such a detailed review of literature? Because you want to know that what is already known about this subject, right? We aim to establish the basic understanding of the case and inform the development of research questions. Because once you do a detailed review of literature, only then you can formulate a good research question and then you can further do the study. So selecting the case, identifying the case, and doing a proper good review of literature is very important. So case should illustrate an important point regarding the management. So why, if you have selected some case, you need to specify clearly that why this case is important, whether there's something new examination you are doing or the evaluation or the intervention or the outcome. So selection of the topic or the case or the phenomena on which you want to do case study is very important. Now coming to next point. Once you have selected, okay, that this is a particular case which has come in the hospital, this is something unique and I want to study on this case. I want to do a case study on this. Next step is you need to collect the data. Choose the right candidate. You have made the inclusion criteria. In case you are going to do on 2-3 subjects, then you need to have the inclusion criteria. Now, the methods of data collection are similar to those what we use in qualitative studies. So in qualitative studies, what are the methods of data collection? Mostly it is observation, right? So it can be a participant observation when a participant is there and researcher is there and you are observing and you have the observation checklist with you. We can also take data from the records which are available in the hospital or wards. You can read the diaries of the patients, you can check the logbooks, you can maintain the field notes, you can check the charts of the patients which are maintained by the nurses and doctors. Another method of data collection is interviews. So interviews can be structured, it can be semi-structured or unstructured. So you are going to interview that client or 2 or 3 clients which you have selected. So when you want to conduct an interview, you will have open-ended questions, right? Open-ended question means how do you think, how do you feel about this procedure? Okay, in which the patient has to give responses in a more elaborate manner. These are not yes or no type of questions. So you must have a proper interview question list to ensure that you are not going to miss even a single query. So you have to frame the key questions and then in between you can give the lead question so that the person keeps on responding. So case studies of individual patients, they often involve in-depth interviews with participants and also key informants. So you also can take data from the other informants. If the mother is there, if father is there, if any other caregiver is there, you can take the information from those also. You can also review the medical records. You can have observational techniques or experts from the patient's personal writing and the diaries. If the patient is maintaining any diary or any notes, you can read that with the consent or permission. Then, so this is how you do the history collection, you can say, like collecting the data by different techniques. Then you also have to explain or describe that what are the steps taken to address the problem. So if you see, this is the same thing like we do, no? History collection, then the physical examination, what is the past history, what investigations have you taken. So all the rich data you are going to put it in your records. Now, you also have to understand that collecting data means giving the intervention also. If you are doing a case study, that means a person has come with some problem, you are giving some treatment. So this treatment can be anything. It can be medicine, it can be any counseling technique, it can be any other thing. So you need to describe the intervention also. That this intervention was given, this therapeutic technique was given to this patient who has given, what was the duration, what was the specific protocol followed, what were the steps, for how many days, for how many weeks, who has given, at what time of the day, for how many weeks, with everything you have to record when you are collecting the data. So history collection, physical examination, past history, and description of intervention, everything is very important. For that, you might have to make some records also, some checklists also, some Excel sheet also, where you're going to put in that on day 1 this was done, day 2 that was done, and then what were the pre-test and post-test scores. So it all depends on what is the objective of your study. The next point is analyzing and interpreting the data. Now, once the treatment is over, you have got the results with you. Now, the next step is to make the sense of those results. What does this result convey to you? Okay. Is there anything unique? Is there anything significant that you want to report? And during this whole procedure, when you were giving this new intervention or new therapeutic technique, whether there were any challenges you faced, and if yes, then how did you overcome them? So a detailed description of all these things should be there in your file when you are analyzing and interpreting the data. And from all these exercises, what are the lessons learned? So what is the key message? And that's how the case study is completed. So what did we do? We selected the case. Okay, we did the review of literature. Then we collected the data, and for collecting the data, we used different methods, whether it was observation, diaries, logbooks, interviews. And then you gave the intervention, you described the intervention. Then finally, when you got the results, you are trying to write in words that what was the outcome of all these exercises. What was the result? Good, bad, unique, significant. And in between, if you faced any challenges, how did you overcome it? And the last step is reporting the findings. So the ultimate purpose is whenever you are doing any study, whether experimental or descriptive, unless you report the findings, there is no use of it, isn't it? So don't just finish your study and put it in the thesis and keep it in the cupboard. Try to disseminate the findings by publications, by participating more and more in your poster presentations or your oral paper presentations or your publications in the journals. And when we want to report the findings, we need to follow certain guidelines. So there are different guidelines which are given by different agencies, and these are the standardized agencies which we need to follow. Now, how to report case studies? A good case reporting demands a clear focus. So when a person is reading, we need to understand that, okay, the person is really focused. It has to be methodical. It should be organized very well, and there should be no grammatical mistakes so that the person who is reading finds it interesting. So to make explicit to the audience why a particular observation is so important, so what is the background and need, that has to be written very nicely so that the person who is reading, we understand that, okay, this case is really important. I need to finish reading the whole case. Otherwise, if it is not interesting, the person will read only the first 2 lines and then they will ignore it. Now, what are the guidelines which we need to follow for reporting? The guidelines is the CARE guidelines. This is the short form for case report. Okay, CARE, case reports. They are developed by an international group of experts to support an increase in the accuracy, transparency, and usefulness of case reports. Like in experimental studies or in the RCTs, you have those consort guidelines. Similarly, for case studies, you have CARE guidelines. So in this CARE guidelines or the CARE checklist, there are 13 points which needs to be followed when you are trying to report your case study. Okay, now we'll just go through these 13 points. What are these? And then we will also read some actual case studies and whether these points, whether the people are fulfilling that or not. So the first one is title, the diagnosis or intervention of primary focus, followed by the words case report. So whenever you are making a title, it should begin by a case report on this, a case study on this. So the word case report must be there in the title. The next point is keywords. So there should be 2 to 5 keywords that identify diagnosis or interventions in the case report. Okay. Then the third heading is abstract. Abstract can be structured or unstructured. If it is unstructured, there will be different headings, the introduction, the patient's main concern, and the conclusion. And if it is unstructured, it will be written loosely, but it will cover all the points. That is, so when a person is reading the abstract, now from that only you can make out that the whole article is going to be interesting or not interesting, beneficial or not. So in the introduction, you have to write what is unique about this case and what does it add to the scientific literature. What are the patient's main concerns and what are the important clinical findings? What were the primary diagnosis? What were the interventions and what are the outcomes? And finally, in the conclusion, you have to write what are one or more takeaway lessons from this case report. So within this 100 to 200 words, you need to write the abstract, which is giving all the key information about your case study. Next point is introduction. So after the abstract and keywords and the title comes your introduction. So in introduction, what will you write? It will briefly summarize that why this case is so unique, why do you want to report this, and it may include medical literature references. So whatever review of literature you have done, you can add in that. So background and need of the study, why it is important. If suppose you are doing a study on some disease condition, you can explain about that till now this is known about this disease condition. Next point is about the patient information. Now, since you are doing a case study, the patient information is very important. So de-identified patient-specific information you have to give. De-identified means you have to maintain the anonymity. Okay, you have to take the consent. You have to follow all the ethical guidelines also when you are conducting a study. So you will tell that Miss X came to the hospital with these complaints. This is the age, this is the gender, and these are the complaints. And then, like I said earlier, you have taken the whole history, the past treatments, everything will be coming in this. So what were the primary concerns and symptoms of the patient? So what was the history? What is the current problem? What was the past problem? What past treatments he has taken? What is the medical, family, and psychosocial history, including the relevant genetic information and the relevant past interventions and their outcomes? It will all come in this heading, that is patient information. So you have to prepare your report in this format only so that it will be easily accepted by the good journals. Then the next point is the clinical findings. Describe the significant physical examination and the important clinical findings. So when you have done you are studying the case in the hospital, you have done some physical examination, you have got some findings. So those key clinical findings you are going to report under these headings. That okay, at the time of admission, the RBC was this, the hemoglobin was this, the serum ferritin was this, X-ray was this, ultrasound findings were this. Okay, whether something you had seen on the physical examination or not in different systems. So all those you can report here. Another one is timeline. The historical and current information from this episode of the care organized as a timeline in the form of a figure or table you can write. So like in the different studies, or the experimental studies or the quantitative studies, we make different tables, figures. So here we are not going into so deep about the statistical techniques and the tables and the figures, but just to make the things more clear. For that, you can make a figure or table that, okay, that on day 1, this was the condition. On day 2, this was this. Day 3, this was this, right? So when something is organized and shown to you in a form of a table or figure, it becomes very easy to understand. So for that thing, we need to have some table or figure. The next point is diagnostic assessment. So in this, you will write in details that for this patient, what all diagnostic methods were applied, different lab values, imaging surveys, and what were the results. Was there any diagnostic challenges that you wanted to do this, but you could not do this because of this problem? Then whether other diagnosis or the differential, how did you rule out the differential diagnosis? How did you rule out the other things? and what are the prognostic characteristics wherever applicable. So in these headings, you are going to give the detailed description of all the investigations. Then the next point is therapeutic intervention. So this case is admitted, he is having some problem, whatever problem, some neuro, gastro, endo. So what intervention you have given, whether a nursing intervention or a medical intervention or a new therapy, a medical intervention or a surgical intervention. So you need to describe that intervention. And whenever you are describing, you need to describe who has given, when they have given, if you are giving some drug, what was the dose, at what time the dose was given, what was the strength, what was the duration, and changes in therapeutic interventions with explanations. And while if you are giving any therapeutic intervention, some protocols were changed, then why they were changed. So all those explanations needs to be there. Then another heading is about follow-up and outcomes. So clinician and patient assessed outcomes if available. So what was the result of that while the patient was in the hospital? And once when the patient goes and then he comes back, what were the results? What are the important follow-up diagnostic and other test results? Whether the prognosis of the patient is becoming better, his condition is becoming better or not, whether the person is adhering to the treatment, what is the tolerability, whether there are any other side effects, whether there is any adverse or any anticipated events. So all those things you will explain in detail. So now you can understand that case study is not so simple, because each point you have to go in detail and describe and then put it in words and then write. So your writing needs to be very good and it should be very clear and comprehensive, and each point should be there when you're trying to explain a particular case. Then the 11th point is discussion. So we said there are 13 points. So we have come to the 11th point. So in the discussion, you will write, what are the strengths and limitations in your approach to this case? Discussions of the relevant medical literature. What is the rationale for your conclusion? Okay, you have given this intervention and ultimately the researcher is there who is trying to describe the findings, who is trying to describe the results. And if you're giving some conclusion that, okay, this is working or this is not working, then what is the rationale behind that? And what is the primary takeaway lesson from this whole exercise which we have done, from this whole case report, in one paragraph conclusion, right? Then next heading is about the patient's perspective you can write. So as we said that it is closely related to a qualitative study. So you can have the experiences of the patient also, and then in their own words, you can put it in the paragraph that the patient should share their perspectives on the treatment, what they have received. And the important thing is that for doing this, you need to have informed consent from the people. The patient should have given informed consent, right? So these are the different steps of reporting a case study. So each and every step of conducting the case study is very important. It has to be done in a very methodical fashion and it has to be reported according to the guidelines. So when you are planning to conduct a study and if you keep the guidelines in front of you, so it becomes easy for you to conduct the study that, okay, I need to focus on all these points. So these are the different examples of case studies. For example, an intraoperative rupture of an intracranial extradural hydatid cyst, a case report and treatment options. Now you see in the title itself, the word like case report, case study, case report, these things are coming, and this was one of the requirement. जब हमने वो 13 steps पढ़े हैं, उसमें the first step was that in the title, this thing should be there. Another example is a case study of transition to a vegan diet in an elite male Gaelic football player. So they are trying to study about a single person who is trying to move from that non-vegetarian diet to a vegan diet. Then another example is extensive deep vein thrombosis following prolonged gaming, a case report. So these are the different links you can open and you can study these researches. It will give you a good idea that how to conduct a case study. Another example is, as I said, that you can study a single person also, or you can study a whole phenomena or a program also. So this is an example of that. Our community, our schools, a case study of program design. for school-based mental health services. So this pilot program to involve school-based mental health services was initiated in one elementary school and one middle high school, and the case study followed the program. So here, who is the sample unit here? The program, from development through the implementation and documentation, each step of the process. Another example is exposure therapy for fear of spiders in an adult with learning disabilities, a case report. So in this study, what was done? One person was studied who had completed a pre-intervention and post-intervention questionnaire. And from the results of this data, the exposure therapy intervention. So they have given the exposure therapy intervention to one person who was having a learning disability also. Some 11 sessions were given and it was found in reducing the phobia. So this case report highlighted a therapy that could be used to assist people with learning disabilities who suffer from phobia. So you can see the take-home message is very clearly defined. Now, as I have mentioned earlier, there are some limitations also for the case studies. So what are the limitations? They can't always be generalized to the broader population. It's difficult to replicate the case studies. Some people say that it lacks rigor. The data collection is not systematic. And since the researcher is reporting, there may be a researcher bias. So these are the limitations. So a case study is a research process which is aimed at learning about a subject. It can be an event or it can also be an organization. Case studies are used in business, social sciences, and healthcare. Case study may focus on one observation or many. It can also examine a series of events or a single case. An effective case study tells a story, so it is a form of storytelling. And it also gives you a take-home message or a conclusion. Now coming to the evaluating of yourself. So try to write the answers. I'll just read the questions. It involves in-depth study of a single case from various angles. So what is the answer of this? Which form of research is this? The answer is case study. Data collection method in case study includes what? It will include different strategies like your observations, your interview technique, your records, your logbooks, your field notes, personal diaries. Okay, next question is, which method is best suited when you want to report a unique case or any adverse drug reaction? Then certainly you will go for a case study method approach. Okay, the next question is, at least how many people are generally included in a case study? So minimum one person should be there. So the next, for case studies, consent is not needed. True or false? So it is false because we need to have informed consent from the patient if we are going to do a case study. These are the references. So thank you. But this is not just the end. I will just share one example of case study with you. Okay, just a minute. Okay, you can see the screen?
Yes, ma'am.
Yeah, so this is the example of a case report. We will just look at the heading and we will see that whether all the 13 points which we have discussed, that whether they have been met in this case or not. So the title is Intraoperative Rupture of an Intracranial Extradural Hydatid Cyst, a case report or treatment options. So the first point is there, case report is mentioned in the title, right? Then they have written the abstract. Such nicely they have written the abstract. A 23-year-old woman was presented to the emergency unit with intracranial hypertension syndrome and blindness in her left eye, which had started recently. So as we said, no, the abstract can be structured or unstructured. So this is an example of an unstructured abstract because different headings are not there, but all the information is there. If you read the abstract, you will understand. See, this woman came, this was the age, Then this was the symptom that she was having blindness in the left eye. Cranial native computed tomography scan was done, MRI was done. It revealed that there was a cystic lesion. Then surgery, craniotomy was performed. And then the therapeutic technique they have described that it was washed with H2O2, then the bone flap was replaced. And finally, we conclude that the most successful surgical approach could be double concentric craniotomy. So a take-home message is also there. So an abstract has to be written very clearly that how the patient came, what was the diagnosis, what were the symptoms, and what new therapeutic technique you have done, and what was the take-home message. Then it has keywords also. Then the another point is the introduction. In introduction, this author is explaining about the hiatus cyst, that what are the causes, what is the background review of literature related to this thing, right? Then patient info and clinical findings. So this is in detail, they are explaining that this woman was evaluated in the emergency unit. She came, these were the symptoms. There was visual impairment, all the weeks. If you read in detail, no, you will understand everything. So very clearly, they have mentioned the whole details about the patient with evidence also. See, they have given the photos of the skull radiography and other therapeutic techniques. So this tells that, okay, that this study, actually that person has conducted this case study. Otherwise, so it adds to the credibility of the research that this is not a fake research, it is an authentic one when you are supplying your information with the evidences. So that is a good habit to do. Then diagnostic assessment and techniques. The third point is there that what all head tomography was done with contrast and what were the findings. And again, they have given the evidences, right? The images they have sent. Then coming to the description of the therapeutic intervention. So that also the researcher has explained nicely that what surgical technique was performed. Craniotomy was done, okay, what wash was done. Washing was done with H2O2 and saline. Then we performed the replacement and fixation of the bone flap. And then they have given the images also of the therapeutic intervention, what they have done. So different figures are there. So you can see that we have a lot of figures here as compared to other quantitative studies, right? Then the next heading was follow-up and outcome. So the first clinical and imaging follow-up was done at 3 months after the neurosurgical intervention and 1 month after the abdominal surgery. And it found the patient with eating difficulties, anorexia, marked weight loss. So like I had explained, no? So when the patient is coming for follow-up, whether he is adhering to the therapy or not, what are the challenges, what are the adverse events, everything needs to be reported. So it is very nicely explained in this case study. Right? Then in the follow-up,
Excuse me, ma'am.
also, yeah.
Ma'am, sorry to interrupt you. Ma'am, we have just 2 minutes left, ma'am.
Yeah, it's just going to finish. Only 2 minutes. I will need only 1 minute here. Okay. Right?
Okay.
So, and then the last heading is discussion. So in the discussion, you will write that when you were giving the therapeutic intervention, what were the challenges and how did you overcome it? What was the conclusion and what are the take-home message? So this is all about how the reporting of case studies needs to be done. In the end, you can also write about the funding, author contributions, conflict of interest, like you do in other also. So whatever the in the first, no, during the introduction, and in the patient information, whatever the person has referred the review of literature that he has put in the tabular form also, and that is a very good way to put on your findings, to showcase your findings, and it all adds to the credibility of your research. So that's all from my side. Okay, I think okay. So thank you so much. So case study is finally, it's a very, you can say it's easy also, but it has to be done in a very rigorous manner, and you need to follow all the steps. And once you do it, you will like it, and it will help you in generating more and more hypotheses. So thank you so much.
Thank you so much, ma'am. It was a very wonderful presentation. And as I already so it was very nice step. So also like how we have to do it. So I hope our information related with this case study method. It was very nice, ma'am, hearing from you. And I would like to express my sincere thanks to you, ma'am, for being with us today for this webinar. Thank you so much, ma'am. And I also would like to express my sincere thanks to our principal, sir, Dr. Ravindra Etchen, for providing me with this opportunity to conduct this webinar. So I think we can conclude here, ma'am. Thank you so much, ma'am, once again.
Thank you for the opportunity. Goodbye.
Okay, ma'am. Bye, ma'am. Thank you.